Now, let's talk about what do you do with all that toothpaste on your teeth that you've just been massaging around your gums and putting it over your teeth? Spit out the big glob. And then it's time to rinse the toothpaste off your teeth. And you will rinse it off with Listerine Cool Mint, or the one I use is the original. And I'm often asked, how come my teeth are so white? I've never used an artificial whitening product in my life for teeth, because they damage your teeth. What I do is strengthen my teeth and make them smooth and shiny with this system so that they reflect light. That's how your teeth work. The enamel crystals in your enamel are designed to refract and reflect light like a diamond. And if your teeth are well mineralized and smooth, that's how you do it. And the original Listerine is just a tad more powerful than Cool Mint. And because it's that little bit more powerful, you will whiten your teeth more. It just makes everything work a little bit better. So it's not essential, and I know you're all going, ew, I can't stand the taste. Or maybe you find Listerine a little too powerful for you, even the Cool Mint. And you need to watch, I have a video on my boot camp that explains this, but I'm going to cover it quickly here. If you have lost healthy biofilm, that is the protective covering we want to develop on teeth. If for some unfortunate reason you have either just had a dental cleaning where they strip that away, or if you have been using baking soda or peroxide, or using artificial whitening products because they strip it off your teeth, or you have a very dry mouth, or you're taking medications that dry your mouth, or you are stressed, or you are a teacher like me talking a lot, that can dry your mouth and actually strip the biofilm off your teeth. So there are lots of different reasons. I mean, if you have allergies and sinus problems, you're breathing through your mouth. I'm trying to think of other things that cause this depletion of the protection that you get from biofilm. Then when you rinse with Listerine, there is none of this waxy protein protection. So it makes your skin cells go, ooh, don't like that. What you should do is only rinse for as long as you can stand it, even if it's a second, but use it full strength. I think that is one of the differences between what I say in my booklet and what I now believe. If you always dilute the Listerine, you'll never get beyond it. If you do it for a second, it's a bit like working out your muscles till they go, ouch, I can't do another push-up. If you stop and rest and let it be, your muscles will grow stronger. When tomorrow you try again, maybe you can do it one more push-up. And it will happen in your mouth. You will develop healthy biofilm by this process of my complete mouth care system. And when you do that, you'll be able to rinse longer with the Listerine, knowing that your mouth is getting healthier. I have clients who email me, Ellie, I'm now at 30 seconds or now at 45 seconds. And that is so exciting to see your mouth actually develop resistance and resilience. That is your defense against everything, against hot and cold sensitivity, against erosion, abrasion. If anyone's ever told you that you brushed your enamel away by brushing the wrong way, that's because you didn't have healthy protective biofilm. Now you're going to develop healthy protective biofilm, and that's never going to happen again. You're not going to brush your gums away. You're not going to brush your enamel away. You're going to develop this healthy protection that is your bulletproof defense against everything that comes in your mouth, whether it's your grinding your teeth, bending your teeth, infection from other people. I can't think of the things that occur, but by doing this system, you are going to become so resilient, so defensive against being attacked by the things that occur in our mouth. So try to go longer as you can with this Listerine, but the minute it starts to feel like it's burning, spit it out. Don't go longer. There's no advantage. It's kind of like working out your muscles too much. They'll just ache the next day and you'll go backwards. Give yourself a break. Do it for as long as you can stand it, and you'll be okay. In a few days, weeks, or months, you'll catch up. So do the Listerine. This is a mouth rinse you want to squish in and out between your teeth. It is liquid floss. This is actually in place of flossing. This is why I don't care about flossing, and I don't recommend flossing. To the people who are using my complete mouth care system, this has been proven to be as effective as floss. They actually once upon a time had a label that said that. And there was a lawsuit, I think it was in the 1980s, where the ADA got so mad that it said it was as good as floss. They made them, obviously money changed hands and it disappeared. But there was a study done by Listerine to show that the old formulations were as good as floss. And the other thing I want to talk about here, similar to the worry about mouthwash, is that it says it kills 99% of germs. People have interpreted that as the fact that Listerine kills all the good and bad bacteria in your mouth. No, there's a word after that. The word is cause. I can't say it with an American accent, but it's C-A-U-S-E. And the thing is, which bacteria cause bad breath, plaque, and gingivitis? It's not all the bacteria in your mouth. There are only a few, possibly 2 or 3 or 4, very few. And the ringleader that we all know about is Streptococcus mutans. I think when this marketing challenge or idea came about, Strep mutans was the only one. It may be now that there are a few more, and I don't even know if Listerine targets them. But if you target immature Strep mutans, which is what Listerine does, if you target the bacteria that form plaque, and plaque causes inflammation, gingivitis, irritation, cavities, everything else in the mouth, if you are targeting that specific bacterium, you're on a good trail, right? And the thing to understand is Strep mutans is a small round cocci, Streptococcus, that's what it's called. Coccus or cocci bacteria are like little seeds. They have a hard outer shell. And they're pretty resilient to everything else. That's why it's such a pain to get rid of. That's why people have such a struggle to get rid of plaque. That's why most people don't know how to do it. And if you develop plaque, you're going to need to floss, and you're going to need to have cleanings, and you're going to need to deal with gum disease down the road as you get older and your immune system can't handle it. But if you use Listerine, and I don't get paid by Listerine, I've never been paid by Listerine, not a nickel. It's essential oils in Listerine, eucalyptus, menthol, and thymol. And these essential oils literally pop the outer shell of this Streptococcus. But only the immature plaque is made up of Streptococcus. So if you don't do Listerine every 12 hours, because that's when plaque begins to multiply and become more like long wormy bacteria, then you're going to need all the rest of my system to deal with these more mature problems. And that's why Listerine alone isn't really that effective. The other problem with Listerine is that it's acidic. And we know that leaving acidity around in your mouth actually generates harmful bacteria. So it's good and it's bad, it's got pluses, it's got minuses. Do you need to worry about all of that? If you trust me, and I tell you some of this so that you can do your own research, but if you simply trust me, use the Listerine, and then the minute it starts to burn,